Hello, my name is Catherine Balin. Today I will be doing my microbiology presentation about the Zika virus, where we will be able to go over a little bit about what this pathogen is, the disease that it can produce, characteristics, the history of it, a little bit about signs and symptoms, as well as how this pathogen actually makes you sick, how it's identified and treated. Let's begin. What is the Zika virus? Well, first of all, this pathogen that causes the Zika virus is caused by a virus from the Flavirus genus or the Flavidae family from the Splendy group. And so in this group, it's also related to other pathogenic vector-borne flaviruses, including dengue fever, West Nile, and the Japanese encephalic viruses, but produces a comparatively mild disease in humans. And we will go over a little bit more about signs and symptoms in the upcoming slides. So, the disease itself is transmitted by human mosquitoes, but there are also a few other modes of transportation that we will get into. Characteristics include a positive sense single stranded RNA, and the size is small, spherical, measuring approximately 40 to 60 nanometers in diameter. And as we can see to the bottom of both the left and right side of the screen, we have pictures of the Zika virus, and up top, we have on our top right the biggest mode of transmission that comes to mind when I've always heard Zika virus. Next, the history of the Zika virus. In 1947, Zika virus was identified for the first time from the rhesus monkey. And it was taken from a cage situated in the Zika forest in Uganda. And this was on a routine jungle yellow fever surveillance. So they were testing for yellow fever at the time. And a year later, the virus was found in a species of mosquitoes known as the Aedes africanus in the Zika forest in 1948. Now, the first evidence of human infection was the detection of neutralizing antibodies against the virus in people in Uganda and the United Republic of Tanzania in 1952. Then 2 years later, the virus was isolated from a girl in eastern Nigeria. It wasn't until 2007 that there were only 14 cases of Zika virus documented without any outbreaks. That changed in April and May of 2007 when the Zika virus began to spread from Africa to Asia to cause an outbreak on Yap Island. Ultimately, 3/4 of the island residents were infected with Zika virus without any deaths, hospitalizations, or neurological complaints. Then, between 2013 and 14, outbreaks from the virus had taken place in four other groups of the Pacific Islands. In March of 2015, Brazil reported a disease with a skin rash in the northeast states. And between February and April, it recorded approximately 7,000 cases, all which were tested negative against common viruses. In May of 2015, the Zika virus in circulation was confirmed by the Brazilian National Reference Laboratory following the epidemiological alert that had been issued by the WHO, or the World Health Organization. In January of 2016, 2 pregnant women in Brazil were confirmed to have intrauterine Zika transmission with fetuses showing microcephaly and brain abnormalities. The virus was also found in the amniotic fluid. Now, this was pretty shocking because although there were cases of Zika being transmitted through semen, they did not know that it could be transmitted through two fetuses through intrauterine transmission. The Pan American Health Organization reported local cases in Puerto Rico and 19 other territories in the Americas. In February of 2016, the U.S. reported a case of sexually transmitted Zika. So, what are signs and symptoms of the Zika virus? Well, first and foremost, there is a fever that is associated with the virus, and this includes rash, fever, as previously mentioned, joint pain, conjunctivitis, and a headache. Generally, the rash is pretty light, the fever is pretty light, and the symptoms last for 2 to 7 days. However, the virus can have more severe effects on pregnant women. And this can include microcephaly in infants, which is an infection with Zika virus during pregnancy, which could lead to a smaller head of a baby than usually anticipated because of abnormal brain development. Other brain malformations include uh, the GB syndrome, which is a rare neurological disorder that manifests as muscle weakness or even paralysis. And as previously mentioned, here are some few modes of transmission. The Zika virus is principally transmitted through the infected Aedes mosquito bite, although other modes of transmission include sexual contact, blood transfusion, and from pregnant mother to fetus. Pathophysiology. So, the Zika virus, first I will go over a more general explanation, which is the Zika virus replicates in a host cell by translating its mRNA into viral proteins and replicating its genome, which then assembles into new viral particles. These particles are released from the host cell, often through lysis of the cell, and the immune system can recognize the Zika infection and respond to it by releasing interferons, which signal nearby cells to initiate defenses and antibodies to neutralize the virus. And we can see that the immune cells recognize the antibody coated virus and clear it off. But the Zika virus can still manage to cross placenta and causing major damage to the fetal brain cells as a major complication. And we've talked about a few of the worst case scenarios, signs, and symptoms previously in this slide. Moving on. The Zika virus causes disease at least in part because of its tropism for neuroectodermal derivatives, particularly in neural stem cells. This virus, following infection, mainly attacks the neuroprogenitor cells that are responsible for brain development and disrupts neurogenesis, resulting in abnormalities in the formation of the brain. In this case, it can cause microcephaly or underdevelopment of the brain and skull, and this can lead to lifelong developmental disabilities in fetuses. The virus spreads from receptor mediated endocytosis, attaching to the cell's surface receptor on neurons and other susceptible cells. Intracellularly, the Zika virus, as previously mentioned, replicates and induces inflammation, contributing to neural tissue damage, and often the immune response enhances supporting neurons. The most important complication related to the Zika virus in adults include its attack with the GB syndrome, a condition wherein the immune system attacks peripheral nerves, leading to muscle weakness or paralysis. Its ability to cross the blood-brain barrier allows the virus to affect the central nervous system, which causes these neurological complications. And the severity of this disease all depends on several factors, including genetic differences in the virus that may alter the ability to infect and induce tissue damage. And the pathophysiology of the Zika virus is highly complex and contextual with significant variability. So, now that we know a little bit about signs and symptoms, the pathophysiology, and the modes of transmission, let's learn how is it identified. So, laboratory diagnosis of acute infection of the Zika virus has been principally based on PCR testing of the blood, urine, and saliva, and this basically tests for the RNA of the virus. And this is able to be done in early phases of the illness, which is normally in the first week of the disease. serological test may determine Zika-specific antibodies, but in people who are thought to have been infected in the past, but this can be there can be cross reactivity with other flaviruses like dengue or chikungunya. And in pregnant women of suspected of having the Zika infection, they can test amniotic fluid, and this can um, happen if there are suspicion of uh, fetal microcephaly or other brain defects. And how is it treated? So there's more of a symptom-oriented treatment, as the articles that I read, which provide support in the recovery process of the patient. And this is mostly rest to allow the body the time to recuperate from this infection, and also ensure proper fluid intake due to diarrhea or dehydration. And acetaminophen or Tylenol can be administered to reduce fever and pain, but in the articles it mentions avoiding the use of uh, NSAIDs like ibuprofen or aspirin, especially when the diagnosis of dengue fever cannot be excluded, and this is because these drugs can further increase bleeding risk. As well as topical treatments can be prescribed or used for rashes to help with the itching that's associated with the rash and provide some relief on that. A few fun facts. Prior to this investigation, I did not know a lot about the Zika virus. I previously thought that it could only be transmitted through the bite of a mosquito, and I did not know that it could be spread through sexual contact, blood transfusions, or mother to fetus, as previously mentioned. And I also did not know that the virus was named after the forest in which it was found in Uganda, and that the reason that it was found was as part of a yellow fever research. I thought this was incredibly interesting. And that is all. Thank you for learning about the Zika virus with me. And here are my citations.